hear things around folks that they don't want to be labeled, right? Hey, it's ADHD. And my the comment I have about that is a medical diagnosis isn't a label, it's a diagnosis, right? ADHD isn't a name to call someone. It describes a clinical syndrome that can be readily treated. Um, and 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 I believe a lot of children who have problems in this area, especially males, especially minority males who have externalizing behaviors, they get interpreted as bad or criminal or aggressive, right? And untreated ADHD puts that individual where they're at a disadvantage educationally and behaviorally. They don't understand what's happening to them. And then as they grow and mature, the more impulsive you are, the more likely you are to get in trouble at some point. And so, and then that's when someone's truly labeled as criminal or a juvenile or other kind of things. And so treatment for ADHD actually reduces the likelihood that someone gets labeled. It reduces the likelihood that they have negative consequences academically, at home, in the community, and with our justice system and all the systems of this country as well. So I think that's really important. And then one other piece to that is I hear folks saying, well, I don't want to be turned into a zombie. I don't want to depend on a medication. And what I like to share with folks with regard to that is, those fears are legitimate. When we have ethnically, culturally, racially based misdiagnoses, you can end up on a wrong medication and get a weird response, right? So that's valid, right? But with appropriate assessment and treatment, those things don't happen. And then, as far as being dependent on a medication, the way I describe that is, the medicines that we use for ADHD are controlled substances. They don't cause you to become addicted to them. They don't cause you to become addicted to other things. ADHD folks who are untreated are more likely to end up taking substances than people who have ADHD and are treated. And oftentimes that's in an attempt to either try to solve the behavioral and emotional problems they're having as a result of it, not knowing that they have it, or to cope with all the negative impacts and consequences. And anyone that I'm working with who takes a medicine long term only ends up in that scenario when they feel certain that they need it and it works. And so I'm not sure that that's a negative outcome, either. We're not making forever decisions in any given moment, but some of these fears really they inhibit individuals' willingness to seek care. And someone with hypertension, high blood pressure, they take their blood pressure medicine and their blood pressure is normal. Are they addicted to it? No. Are they dependent on it? No. Do they need it long term? Sometimes yes, right? And so we see similar things with this, but again, that the stigma can make people feel like they're going to need a medication for their brain to function normally, or for them to stay who they are. It doesn't change their personality. And that's just not how it plays out. Those individuals, when I've worked with them and they've been willing to trust enough to engage in the process, most of the comments they get is that, I'm seeing my true child show up, right? He or she wasn't these behaviors. They aren't bad children. They do value education. They want to learn. And now I see that this was in the way. And now that they've got effective treatment, they're just so proud and happy to see them be able to engage in those things, learn those things, express themselves that are really more true representations of who they are. It's just that the ADHD was a barrier and we removed it.